Understanding Body Dysmorphic Disorder. What is body dysmorphic disorder, or BDD?
So body dysmorphic disorder is a psychiatric condition where people have a concern about something about their appearance, and they think that their appearance is defective in some way, or it's ugly. These are usually things that other people can't see, and they're so concerned about it that they think about it all the time. They usually can't function very well because they're either thinking about it all the time, or they're engaging in all these behaviors to try to change it in some way, or they're avoiding going out. So it really significantly affects people in terms of their functioning, their relationships, and how they feel. It can be a very severe psychiatric problem.
What is body image?
Body image is how somebody feels about their appearance. And body image, the term, I think, usually people think about kind of two different aspects of that. One may be how internally they feel about themselves, and the other may be how they actually see themselves. So, for example, when somebody looks in the mirror, they may see themselves a certain way and think a certain thing about their appearance. And internally, though, they may have a certain kind of idea about how their appearance is. And so I think body image really probably constitutes both those components.
How do you know BDD is a real disorder and not just an excuse for vanity?
Actually, body dysmorphic disorder is probably the opposite of vanity, because vanity is when somebody, they do think about their appearance a lot, they may look at themselves in the mirror, but usually they like their appearance in some way. So they're kind of taking pride in their appearance, they're feeling really good about it, maybe they're overemphasizing it, but basically they like their appearance. Body dysmorphic disorder is the opposite, because people do not like their appearance. They think that they're ugly. They think that something's defective about their appearance. So, and most of the time they wish that they didn't have to think so much about their appearance. So it's really almost the opposite of vanity.
How do you differentiate BDD from normal appearance concerns?
It's not just having some concerns about appearance, because everybody has some concern about their appearance. I mean, all of us have something about our appearance that we think is not great or wish was different in some way. But body dysmorphic disorder, it's really qualitatively different and quantitatively different than kind of everyday appearance concerns. You know, this is something where people really spend literally hours a day, like sometimes all of their waking hours, or 6-8 hours a day thinking about their appearance. And they're thinking about it and believing there's something defective. When other people look at them, they can't see it at all. It looks completely normal to them. And on top of that, they engage in all these behaviors to try to reduce the concern in some way, or reassure themselves, or change it in some way. And those behaviors themselves are very time-consuming and interfering with their functioning. So it's something, it's really above and beyond a normal kind of appearance concern. This is really a psychiatric condition where they can't get these thoughts out of their mind, and they're probably having an actual perceptual disturbance in how they're seeing themselves.
How can BDD destroy lives?
Well, BDD can really destroy lives in a lot of different ways, and usually it does in multiple different ways for people. So, for example, taking their work function. And people with BDD, because they think so much about their appearance, it's constantly on their mind, they have a lot of difficulty concentrating at work. Usually they can't focus on what they're doing because they're having these thoughts. They may feel very self-conscious at work, constantly thinking about what other people are thinking about them, or sometimes even believing that other people are like laughing at them when they aren't. Or they're doing research on the internet about how they might get a cosmetic surgery to change their appearance. So definitely can significantly affect work function. They may not even show up to work. Even like friendships it can affect, because they may not feel comfortable around their friends in terms of how they look. And so they can isolate, not go out of their homes. Other things, like even with family members, they may have a difficult time because they may not feel comfortable in terms of their appearance around their family members, or they may ask their family members for reassurance about their appearance, which causes conflicts because the family member just keeps getting tired of saying, you look normal, there's nothing wrong with your nose. And then on top of that, they experience a lot of distress. So they often get very depressed. About 75% will meet criteria for major depressive disorder with the body dysmorphic disorder, almost always as a result of the body dysmorphic disorder. And they feel ashamed and they feel anxious. And so internally, they go through a lot of emotional turmoil because of it as well.
What are the warning signs of BDD?
People with BDD, they experience some things internally, like emotionally. They usually feel depressed, they feel ashamed, they feel anxious, concerned about what other people think about them. And then there's the external symptoms or like signs that somebody can actually observe them doing. And so those are like mirror checking is a very common one, or mirror avoiding, scrutinizing other people's appearance, comparing to their own. They may do what we call camouflaging, where they try to cover up or change something about their appearance or use makeup to cover up something. And then they may actually pursue cosmetic surgery or dermatology procedures to change what they think is defective about them.
What happens when someone with BDD looks in the mirror?
So when they look in the mirror, what they see is usually something that they think is defective about their appearance. And for some people, it may be something where it's like a distortion. So yes, people do have pores on their skin, but what they're seeing is they're seeing it kind of in a magnified way and really kind of out of the context of the rest of their face. Or they may see things that other people can't see at all, like they see a bump on their nose and other people see a straight nose when they look at them. And so they really see something that's defective, and they see it in a way that it looks horribly ugly to them. I mean, it really looks hideous, and it's very disturbing.
How can BDD make an attractive person believe they're ugly?
We're still trying to understand that. It's really a mystery, and as we learn a little bit more and more about some of the neurobiology, we're trying to figure that question out. But there's possibilities that it may be something to do with chemical abnormality. We really have very little evidence about that now, but people are exploring that. And there may be something very different about how they're visually processing information that they see. And so we're also investigating that as well.
Why is it important to understand BDD?
Well, it's important because we really need to develop good treatments for it. And as of right now, we understand a lot of the symptoms of it. We understand how to identify people with it. And there are a few treatments that can actually work fairly well. But we really don't understand everything there is about what's going on in a person. Like, how much of this is related to their brain chemistry, how much of it is related to their processing of visual information, how much is related to societal effects, how much is related to their own psychological issues. Most likely all these things contribute, but unless we understand them better, the treatments may not work for everybody, or they may not work as well as they could. So we really want to understand it so we can develop better treatments for it.